You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Karen Seagraves, who is the healthcare advisor and consultant at the Firework Factory. Welcome to the show, Karen.
Hi, thank you for having me.
It is so good to have you here. This is going to be a very fun conversation. I know that already from some of our previous chats that we've had.
Yes, I think I've been more excited about this day than any meeting that I've had in a long time.
That's fantastic. So let's go ahead and get started like I do every episode and tell our audience a little bit about your background and what you've been up to these days.
Well, my background is actually clinical. So my first practical professional position was as a nurse, and I spent many years at the bedside. So working in nursing, and then as with any profession, if you show even the slightest bit of proficiency, someone asks you to take on leadership roles. So worked my way through becoming an educator, a clinician, becoming an advanced practice provider, and then was pulled into executive leadership and first as the executive director of a large neuroscience center, and most recently as an enterprise vice president of a large healthcare system in neuroscience.
Awesome. And so what are you up to these days?
That's a great question. Not what I was doing before. So one of the things that I realized as I matured in my field was that, you accumulate a lot of knowledge, whether it's bedside clinical practice or practical administrative leadership experience, understanding some of those responsibilities when they come to strategic planning for a program. And I recognized that there were a lot of people who need that information as they are developing ideas that they think might be solutions for problems that we have in healthcare. Mm-hmm. And through just a natural organic process and speaking with a lot of individuals who I've collaborated with on research in the healthcare space, found out that information is actually something that they need to be successful. And so I began to branch out into the AI space and speak to different startups. And it has led to a really exciting time in my life because I'm able to apply all of that expertise in optimizing their solutions.
That's fantastic. So what are some of the projects that you're working on right now?
So a few of the projects I've been working on, most recently, working with a company in the background, it's a natural language processing company. Mm-hmm. And what they're currently doing is a patient identification process. And by that, I mean, this technology, and the company is Pentavere, if people are interested in knowing more, but you are able to identify patients who are falling through the cracks or not receiving treatment. A great example that they've done in Canada is related to heart failure. And they are on board nearly 10,000 patients. They've been able to actually go through all of the medical records for the patient, and it's in any format, notes, PDF, any other media, and actually find, based on all of that information, who is not currently being treated with evidence-based practice based on the National Heart Failure Guidelines. It then populates a list for the cardiologist or for the clinicians and prioritizes that and dashboards it for the provider. So essentially, it's the first time I've ever seen any type of solution that can prevent things from happening in a patient. So I am a neuroscience person. My love has always been stroke, and I've spent most of my career working with the stroke patient population. And unfortunately, we get them after they've had a stroke. So everything is always focused on secondary prevention. But with something like the Darwin solution that's part of Pentavere, you can actually say, well, they have every comorbidity and risk factor, and 85% of strokes are preventable if you manage the risk factors. And you can actually go through an entire primary care practice or ambulatory care and say, we need to pinpoint these patients and get them on the right solutions for preventing that initial stroke. So it can be applied to any disease process, any healthcare. That's
so
exciting.
One of the things that I hear you saying when you just talk about your background and experience and, kind of think of what you have to bring to the healthcare ecosystem is this really unique blend of both clinical and administration, and bringing bringing that expertise and those insights into the startup or innovation world. You know, I've had some conversations previously around adaptation or adoption. And a lot of times when I'm talking to innovators or working with them, they're thinking that I'm going to build this solution and then my goal is to commercialize it, which is to sell some stuff, right? And then once I sell it, my job is done and now I'm moving on to the next sale. And a big part of the challenge that we have in healthcare right now is really adoption, right? So years ago, there was just a lot of talk about innovation and no one was really doing it. Now, a lot of people are doing innovation, but adoption is our real big struggle here. So what are some of the lessons, kind of thinking about your experience in working in the health system? What are some of the lessons that a healthcare system could learn from your experience in how to be able to adapt and shift to have more success in implementing innovations?
It's funny you should ask me that question, because that is a huge passion of mine. I recently spoke at an AI conference about this exact thing.
Yeah.
And it's about really overcoming the chasm among administrators, clinicians, and all of the fabulous startups out there who have solutions. Mm-hmm. And I can give you some specific examples about pitfalls that really undermine the success of a solution, even if it's the best possible thing. It's fabulous technology. So as a clinician, I'll go back to my days as a bedside nurse.
Yep.
You're only as good as your end user, right? The person who is going to be required to participate in order to use the solution in the way that you hope to see it used. So we were talking about this actually before we came on the air. If you expect that something that's going to pull information from an EHR to be successful, then you are dependent upon information going into that record. Anything from notes or monitoring or physiological parameters. And when you think about who is the most likely to be documenting in the medical record on an ongoing basis, 24/7, that is the nurse.
Right.
And you are dependent upon the location of that documentation, the frequency of that documentation, the accuracy. And if you expect that individual to say, well, you're asking me to populate this new page or this new flow sheet or these new notes in this record, I need to understand the value. I need to understand what else I'm not going to have to do if you're expecting me to pick this up, because there's no way in the world any nurse is going to want to double document anything, anywhere. Or you run into a situation where many of the EHRs have the opportunity to say WNL within normal limits. So instead of doing the assessment and really populating each discrete field with a particular observation, it's just the same. And the magic of that, when you go back and think you have a solution that's going to be able to tell you something about a patient population, is that at shift change, you suddenly see a change in the patient condition. Why is that? Because now there's a new nurse coming on and they're observing the patient. Mm-hmm. Does it mean that every 12 hours the patient has a complete change in their physical condition? No, it's documentation. And so really understanding, as a bedside nurse, why do I need to do this? Another example would be evaluation of product. So very often you've got devices, and probably the most funny and interesting device that I remember we were trialing just before I left Grady in Atlanta, which is a phenomenal institution for research, was the female urinal. Mm-hmm. So you think about it, when you've got a bedridden patient, you have all these fabulous things. If you're a male patient, you have that little pitcher thingy, but it's much more difficult for a woman. And if you imagine for a poor woman who's either just had a baby or had spine surgery, and you're trying to get on a bedpan, that is not conducive, right?
No.
So a lot of people have tried to come up with these fabulous ways, but even more importantly, there's accuracy in critical care where you need to have accurate input and output. So you need to know exactly the volume, right, of anything. And so how do you measure this appropriately? And I remember that the nurses were expected to trial a device for a certain period of time. So it would be a month of one device, a month of the other device. But what it all came down to were these pieces of paper where they had to give their feedback and put in a box.
Mm-hmm.
Ask me during a pandemic if you think anyone has time to fill out an investigational form about a piece of equipment or a device or any solution and give you the feedback that you need.
Right.
Absolutely not. So what's going to happen is the hospital is going to go with whatever's the best or most efficient financially, right? Whatever the biggest discount or the biggest perk or the bulk purchase. And then the product's going to come in and it's going to be on the shelf in your supply room. And no one's ever going to use it. They might say, well, I hated that. But you didn't get the feedback. So that's just one example.
And that's so important because there's so many pilots that are happening across the country. And you know, I think that there's a lot of value in those to both the health system and obviously to the startup company. And if we don't have a champion, if we don't have these insights, you know, it could be to the detriment of the pilot's success or the perceived pilot's success or failure. And so then the health system's missing out on a huge opportunity to really bring an innovation that could save money, that could improve patient care. Yeah. And of course, the startup is then losing money on the potential of a success story and, you know, future revenue if we're not taking into consideration all those little nuances in that process.
Without a doubt. And another big pitfall is not necessarily not engaging the end user, but multiple initiatives. So here's something that you have to ask. You might think you found the perfect site for your use case or for, you know, your partnership or approval or research collaboration. And you might actually have a really great product. However, you might also inquire as to whether they have other initiatives or implementations going on at the same time. So perfect example, an organization undergoing a transition to a new electronic health record. So if you're doing your Epic implementation, you cannot expect that everyone's going to want to try out your new app. Right? Or your new, especially when they're being told you have a communication component to that application that's going to be required as part of your new electronic health record. But you're also looking at something that might be in a service line specific vein where, you know, you're going to be notified early about a potential patient for treatment. And you're having to do that and work together at the same time they're transitioning to a new record. So you've got to time it properly. Also scaling. If you think that you can do an entire system at once, maybe if you're a very mature company, you might still be considered a startup, but you may, you might have 1,000 hospitals that are using your solution and you've done some implementation. So, you know, we're more efficient now. We can get there. We know what we need to do. But sometimes it's really important to work the kinks out, maybe at one hospital site or one clinic, and then get that, you know, get the details ironed out and then roll it out with your lessons learned. And I would say, you know, lastly, you know, sometimes you have to remember that the person who was most vocal and who was the champion and who was able to bring that initiative in may, as it turns out, be the only person who really, really loved or understood the solution. So I cannot say enough about boots on the ground support for implementation. If you have people there to hold your hand, walk you through, show you the benefit, make it easy, you are much more likely to have adaptation. If you open something up or look at something and it doesn't quite make sense or it glitches the first time or it's just user error, chances that that person or that provider or that clinician is going to go back and attempt to use that are slim to none, and then they will find a workaround.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. I encourage clients when they're, working through this process that a lot of times we're thinking about the champion that you're referring to. We might be thinking about the blocker, right? Like especially, and I'm talking about pre-sales as well as, post, like the implementation phase. And I encourage people to also identify a Trojan horse. And this is someone who is probably a much lower level in personnel, but these are just the information gatherers. These are the ones that really know everything that's going on, and they're just kind of giving you the scoop. So they can let you know if your champion left. They can let you know if there's more blockers. They can let you know all the politics that's going on, and they'll happily do so. But they're kind of like your fly on the wall, so that way you can react and optimize as you need to. Mm-hmm.
Oh, absolutely. You're insider. And I will say, in a lot of the early AI radiology, there were so many solutions for neurosciences, and there still are. I mean, they're fabulous. And, one of the companies I work with is called Viz AI. And one of the things that we're very good at is establishing a relationship with the person who coordinates the program, right? The stroke coordinator, who is, I would say 99.9% of the times a nurse. So that person is instrumental in understanding the regulatory requirements. So if they have certification, but also they know all of the providers who work in that patient population. They know the inpatient units, they know the follow-up and the clinic responsibilities and the navigation. They will know if a solution is needed. Mm-hmm. They will know, how people feel about the current situation versus the potential solutions out there. And they're doing it. I like to say that they're doing it for the right reasons. Mm-hmm. And this brings me back to my nursing roots. I like to say I'm sort of an administrator brain, but a clinician heart, because if your intention is to do what's best for the patient, mm-hmm. if your intention is to improve quality of life and outcomes, you're going to be honest. You're going to be honest with yourself, but you're also going to be honest even with the flashiest and most beautiful company that comes in and tries to sell you their solution. It has to solve a problem that your patients have, or your clinicians. We talk about resilience and quality of life and everything that we were so overwhelmed by during the pandemic. Is it a solution that can make quality of life better for the provider? Mm-hmm. To avoid burnout, or to help administrators maintain a connection with their frontline staff. So is the solution doing something for the right reasons? And then I say, lastly, is it something that's going to benefit the system? And having an insider who really understands, what are the system concerns right now? Are we having a problem because we don't have the manpower? And if we don't have that, then how are we supposed to manually abstract data for certain required elements? If there's something that comes in and says, I can do 800 abstraction hours in 12 hours with this software, maybe that's the right thing, because we can't do it and we don't want to be non-compliant. We don't want to put patients at risk, and we have, external regulatory requirements. So maybe it's the right thing for the system. So for the patient, for the people who work here, and for the system. And I think that those clinicians have that at heart.
There definitely needs to be a value proposition for every stakeholder group that's involved in the value chain. And so many times we overlook some of those key, especially users. We think that there's going to be a lot of benefit to the system, kind of like you're saying, and the end user is kind of just overlooked and forced this solution on them, whether it's the patient or the provider. And that's where a lot of our stagnation is happening with the actual adoption.
Mm-hmm.
Yeah.
Without question. And it's one of the things, I mean, I think that being in a unique position, having been that clinical bedside provider, having actually physically cared for patients and understood their concerns, and then being responsible for the people who care for the people, right? I spent a lot of time taking care of my staff and understanding what their needs are and what their concerns are. And so I think it would be negligent for anybody trying to get into this space. And this is one of the reasons that I've been going and speaking at AI conferences. And I'm so grateful to my colleagues there, because I was clueless about so much of this terminology. Like, thank you to AI Med for, giving me an entire glossary of some of these terms. I even noticed recently that there was a term missing that was becoming popular from the glossary. And I was like, oh, we need to add that. But it's a natural, it was a natural fit for where I was in my career. And I also realized that when you reach a point that you feel stifled by being in a brick and mortar and approving time cards or something, that you're not feeling passion. And you and I spoke about it earlier, that I named my LLC the Firework Factor, because I think about fireworks and how they ignite, and one ignites the next. And then they make this fabulous and incredible life-changing chemical reaction that's a beautiful display. That's what happens when people talk to each other. That's what happens when you pitch an idea, or when you sit in front of an advisor and the advisor says, you know what, have you thought about using it in this space? It's a totally different direction. The fireworks start to go off and you say, no, I never thought about that. That's a great idea. Or quite the opposite. They think they have a great thing. You say, well, you do realize that these other 6 people are already doing that. And that's kind of standard in healthcare today. And they're going, oh no. So I think that the value is really that experience and that lived experience. And by the way, I also think so many of our Gen Z startups are, they're phenomenal. And I love their energy and the excitement. But what they haven't yet had was life experience. And when you have life experience and you have years behind you, and you can understand all of the different generations and what they fear and what their thoughts are and how they feel about technology and adaptation, you're much more likely to appeal across that entire market. And so I think the value of having that experience and that life experience and offering that guidance is first of all, it's necessary. But second of all, I think it offers us an opportunity to be in a very different and exciting space.
Yes, definitely. So we touched on pitfalls and some lessons learned, or some guidance to health systems who want to have more successful implementations of innovations. We kind of touched on a little bit of it from the startup side, but are there any other lessons learned that you would want to share to the startups that are in the audience that are, earlier stage, and they are bringing these innovations to market, whether it's a pilot or whether it's some commercial endeavor, and they're thinking about, how do I be more successful with the adoption of my solution?
I do. We haven't talked about the executive suite, right? We haven't talked about the C-suite.
Yep.
It is so important to understand the market where you are trying to enter. So if you are in a space where you've got an innovation that might be a real opportunity to help with patients who are underserved, with patients who really, and we see it now, and so much more attention has been paid to that, where we have, patients in this country who are absolutely left out of that process of considering, how do we provide healthcare, and there's a huge amount of inequity. So if you are pitching in that environment, you've got to understand the focus is probably on public and community health. You want to be in a space where there's a great interest in protecting the population so that they don't develop the conditions that are then going to be costly. They're going to impact productivity and quality of life, and keep families at home and not at work. Yep. So understanding the culture of the organization where you think there's value. If you are pitching to a system that wants to be the top, most innovative, you need to understand, okay, what do their competitors have? What's in place in that same market? They want to be first, right? If they want to be first, if they want to be best, if they want to be only, then that's what you have to sell. So understanding your customer and understanding the culture of the organization. And, there are a lot of ways to find that out. Watch their social media, see what they're championing, see what they're proud of, see what they're known for in the community, read what their patients say about them. And then you'll get a good feel. Look at their website. Are they talking about their new state-of-the-art robotics program? Or are they talking about their community health initiatives and food as medicine? And then you can get a better understanding.
So what about access to this group? Because access certainly has changed, right? The way startups might access those C-suite decision makers prior to the pandemic was different than what it was during the pandemic. It's also kind of different than it is now. So as someone who's got experience in those roles and in those org charts, how would you recommend that someone get in front of those key decision makers to be able to create awareness or demand for their solution?
You're right. It's very tough now because you don't have an open door like you did with a great idea or a great pitch.
Yep.
But you do have service line visionaries or people. Many times now there are innovation departments or strategic, technology, CTO, CIO. There are departments that are around these initiatives. And very often in the larger institutions, they're looking to partner because a lot of people lost a lot of money in the last couple of years, right? You hear health systems, the biggest systems losing over $1 billion first quarter of the year, second quarter, again, the same thing. So if there's an opportunity to partner, and remember that in the beginning, you might be giving your solution away for free, but then you are going to build your evidence, you are going to build your reputation and say, oh yes, this institution is using our solution. And then you're going to be able to sell it to the next one. But I think it's really important to recognize that building the relationships first with the clinicians who are going to be managing. Now, if it's not clinicians, if it's not a clinical solution, I'm working with a company that's a financial solution, and they are actually working on a very discounted process for healthcare workers to consolidate their debt and pay off their loans at a discount rate. So it's like basically taking care of the people who take care of the people. And that would be something you would go to HR, you would go to the chief human resource officer or benefits or talent acquisition to say, this would be very attractive as you are facing this challenge of having nobody to hire out there and a very tight marketplace for your frontline workers. Here's a benefit you can add to your armamentarium so that you can bring these people in. So I really think it's a matter of thinking, where exactly am I trying to get in? And then building relationship with those individuals. Once you've got that, they're the ones who are going to take it to the C-suite. You will never get to the C-suite first, right? So it's got to be like the clinical solution or the HR solution. And those people are much more accessible, but then they're part of an executive team that can get the buy-in for that.
Yeah. And what comes to mind, what I kind of hear you describing is an ABM strategy, an account-based marketing strategy, where you're coming up with a target list for your sales opportunities. And then you identify all of the stakeholders that could be part of that decision-making process. And then courting and nurturing all of them simultaneously, maybe in different ways, maybe through different channels and different means, but courting them all at the same time. So that way you are kind of creating a little bit more of that word of mouth, a little bit more of that momentum within the organization, as opposed to just picking one stakeholder group to engage.
Mm-hmm. Exactly. And you're building a buzz, but something you said there, it's really important. You've got to build the relationships. There has to be trust. But something else that you need to do is anticipate what the questions will be. So that's something that I've started doing is practice. So if you're going to finally make it in front of some of these individuals who are going to have influence to be able to make a decision about bringing in your product or your solution, you need to be prepared for their questions. I'm actually giving a talk next week in Orlando at ANVC. It's the Association of Neurovascular Clinicians, and it's called Navigating Corporate Politics. But what I do is I talk about all the different types of administrators and how to approach them and prepare and follow up on those conversations. There's the just say no, right? The person who always says no first and then says yes. There's the person who wants data. So you've got to be prepared with your research studies, your publications, every scenario that you have that actually has evidence, and you need to be prepared with that. Another piece is, remember that a lot of times folks are blindsided. If you are a chief medical officer or if you are a chief operating officer, you might not know nuanced service line specific solutions. So you might need to give them a very rudimentary, overarching explanation of what in the world you're talking about and stop using acronyms, right? I am the worst because if I'm talking about things in my field of expertise, I sound like I'm just singing alphabet soup. But when you're talking to me about things and a lot of some of the terminology, I'm just sitting here, I'm going, I don't know what that means. I don't know what that means. And you can't be afraid to say, I don't know what you're talking about, by the way. You have to just ask. Yep. But getting in front of administrators, you cannot assume that they understand as much as you do about the problem you're trying to solve. But framing it a way they can understand a big picture of what the solution is, how does it help them? Be prepared with the answers. You have an issue with length of stay, or you have an issue with loss to follow-up after discharge, or you have an issue with readmissions. Understanding how does this solution offset the problem that you're trying to solve?
Definitely. Well, Karen, thank you so much for joining me today. This has been really incredibly valuable. A lot of times I'm bringing guests on the show that are talking about their commercialization journey. But I always like to also add influencers in the industry to be able to contribute to other pieces of this process and of this ecosystem that aren't always reflected here or aren't always shared. And certainly the adoption and the implementation and the success of that is a critical part of really being able to transform the healthcare industry. So thank you so much for joining me today. How can people get a hold of you if they want to follow up with you after the show?
Oh, easiest way in the world. I'm on LinkedIn and it's Karen B. Seagraves. And then you could also email me. It's karenbseagraves@gmail.com.
Awesome. Well, thank you so much for joining me today.
Thank you for having me.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.